Welcome back to KLAS in Session, where we're turning provider voices into value in healthcare IT. I'm Mac Boyter, and today we're diving into the heart of competition in ambient speech technology and what their provider customers say sets one solution apart from another. If this is your first time joining us, we ask that you subscribe so you don't miss the rest of the mini-series or future KLAS research insights. Today's discussion is grounded in our latest Ambient Speech 2025 report. This is where we explore differentiators of what mattered most to providers, from tech innovation to service models. If you're a provider who's trying to choose between similar sounding vendors or a tech company working to clarify and elevate your offering, this episode will give you some much needed information. The links in the show notes will also give you quick access to the full report and any KLAS event info. Let's get started. One of the most fascinating aspects of working at KLAS is the ability to actually talk with providers, teams that are deeply in the throes of implementations or decision-making. And as over the last 8 to 9 months, I've spoken with over 200 health systems personally and had the opportunity to hear their challenges, their goals, what their difficulties have been, but also those benefits of implementing new solutions in the ambient space. One of the things that really stood out in our report, but also from those conversations, was how is one vendor different than another vendor? They all kind of do the same thing, right? They all take unstructured conversation information and then put it into a note so that it can actually be, documented and have that validity. What we found through our research is that there are some significant differentiators. Let me give you a couple of examples. First of all, Bridge and Microsoft X Copilot, now Dragon Copilot, they are highlighted in our report for having deep integration, for example, with Epic. Epic's Workshop, which is part of their showroom functionality, brings vendors into the fold, so to speak, and allows for deep integration. In Haiku, you can actually open up Haiku, speak into the record, and it goes right into hyperspace hyperdrive. It's a very big difference for teams that are deeply enmeshed with Epic functionality already and are looking for that next level. However, there are other teams that are taking a little bit of a dichotomous approach or more direct approach, as it were. Oracle Health, for example, has their CDA product, which is their literal direct product, their clinical digital assistant built into their EHR. So from the get-go, there's no copy paste, there's no other outside influence. It's allowing the tools to actually work and breathe and live within that. Other third-party tools like Suki, Ambience Healthcare, DeepScribe, Nabla, and others, we validated deep integrations, but with other health systems and with Epic as well. So when it comes to integration, yes, there are differentiators, but at the end of the day, it's less than you might think. One of the things that we talked about briefly in our last conversation was cost. Cost is top of mind for health systems. One of the major reasons for adopting these systems is tangentially and directly to ameliorate or to reduce the amount of clinician burnout, which our research shows is a significant issue. Not only is it a significant issue in terms of doctor shortages and APPs and clinician shortages, but in terms of cost for health systems. By our research, we see that to replace a nurse is typically about $56K just to replace a typical nurse. For a physician, a general practitioner, it's up to about $1 million, $500,000 to $1 million. That's a significant amount of money when you're talking about clinician burnout. And if there's tools that can help ameliorate or lower that risk, that's something that is really important for a lot of health systems. Beyond that, having more clear, accurate notes can massively impact denials. It can impact other aspects of the coding and charting process. And we're already starting to validate that in our other reporting, what we call ROI validation studies. Those studies are designed to highlight the difference and validate the differences between vendors at health systems specifically, whether that's, again, work RVU increases, whether that's other cost indicators and benefits, patient indicators. So the last thing I wanted to share with you, when we did our reporting in the Ambient Speech 2025 report, one of the things that really surprised me in our reporting, and frankly I thought was interesting to share, is that when health systems are looking for one hand to hold, they're bringing in multiple different teams for piloting. And that's great. It allows for plurality of choice. It allows for really stress testing those different vendors alongside each other to see which one is the best fit for your system. But a word of caution, as you're piloting those systems, don't just let people raise their hand. Don't just take volunteers. Because those technophiles, those volunteers, those people that are amenable to that opportunity, that technology, they might be more keen to maybe elide over any issues or problems or deficiencies. So make sure it's a robust pilot. Make sure you're bringing in the naysayers, the people that are a little bit more negative about the prospects, and give them an opportunity to see why this is something that might be a differentiator for them. I think that gets better buy-in, and it allows you as an organization to be able to see that difference. The very last thing I'll share with you for those vendors who may be participating in today and watching the conversation, you have to be able to clearly articulate what is the value proposition, what is the differentiation, not just the cost savings, not just the price and the integration, but also how are you willing to work with those health systems to meet physicians and clinicians where they're at. That's a major differentiator, and it's going to get you in the door, and frankly, it's going to help those health systems make good decisions. That wraps up this episode of KLAS in Session. We've looked at how vendors are trying to stand out and what provider organizations are noticing most. To dig into the specific data, please download the Ambient Speech 2025 report using the QR code below. Next up, we'll close this three-part series by focusing on the outcomes, what real-world users are seeing after deploying ambient speech solutions.